Like Vonda said, my name is Ashley Griffin. I am a social worker. I actually graduated from USU a year ago from Vonda's class. And I work for Primary Care Pediatrics here in Logan. We are a pediatric clinic here who I feel like we try really hard to ensure that we're touching all the bases for our patients. We get a lot of comments about that pediatric care is just more so about the well checks and making sure that you've checked off the box, you've got the shots. Our doctors like to do a little bit more of the mental health end of that, even though it's kind of weird to think of our little kids needing mental health, kids that little needing mental health. But we have kind of discovered that it is something that's really important for kids that are younger. Resilience is an important factor in patient care for our physicians, like I said. We take multiple different measures. We start them as little as we can with the Ages and Stages questionnaire to make sure those developmental milestones are being hit. But just recently we have started doing the ASQ in our office, which is what I'm going to talk to you guys about today. So let's see if this will let me. There we go. So what is resiliency? This is a huge question that we get asked by parents a lot because our physicians will say, we feel like there is some resilience delay or there's something missing in the child's resiliency. So resilience is the ability to bounce back from stressful situations. Resilience can be learned, practiced, and improved upon. Some studies have even shown that the resilience skills help people to avoid the health problems that come from ACEs. Does anybody have questions on resiliency at all? No? We're okay. Okay. So what we do for the child is, like I said, we start with the Ages and Stages questionnaire. Those are given at specific developmental milestones in our office. Its main purpose is to pinpoint the development of the child. If the child shows signs of delay, so say at a specific age they're not able to mimic your action or can't tell you their colors, things like that. That's where I come in. Most offices here in the Valley have a registered nurse that is just a care coordinator. As far as we know, I am the only actual social worker in a clinic here in the Valley, which we kind of are excited to get up and going because we've seen some good improvement in some of our children, and I'll talk to you guys about those later. What I do is I go in and mom and I sit down, or dad or whomever is in with the child, we sit down and we make a game plan with our physician. So a physician will explain to me what those developmental delays are and what is best medically for the child to get caught up. From there, a lot of the time I refer to up to 3 here in the Valley, just because they take really good care of our little ones. They are fabulous. We love up to 3. And then what I do to kind of put mom at ease is we sit down together and we make kind of a timeline. We talk about when we're going to call, what it looks like to get in, what to expect weight-wise, because there is a large waiting list for most things here in the Valley, especially when it comes to mental health. And then once we do get in, what time period we would like to kind of reevaluate the child on. Obviously, the child will be coming back in for their next well check, but we like to, I like to call mom and just be like, hey, how are we feeling about our plan? How do you feel like little Johnny's doing with his colors? How do you feel like you need more intervention? Do you feel like you are ready to back up on up to 3? Do you need to see the doctor sooner? And I found that it really helps parents. But I've also found that it really helps kids. We've had a few kids come in who have been adopted, who've come in through adoption, and have been extremely developmentally delayed for their age. And I have seen wonders worked with up to 3 in the last year. We had one child come in who was 5, who was barely speaking, that now will sit down at his WellCare visits and he'll read me a whole book. And it's awesome. Does anybody have questions about the ages and stages? Yes?
Do you use the SE one ever for evaluating the social emotional development?
Yes, but we do that at an older age. We like to give that one at older because we found that parents and children were having a hard time pinpointing the emotional end of it. No, you're just fine. I'm just trying to, because we haven't done it. They didn't do it while I was in office. They were doing it before I was there, and they just told me that people were having a hard time pinpointing so that most parents wouldn't fill it out. So we do it as they get older so the child can actually fill it out like for themselves, is what I've been told. Any other questions? No?
Actually, the ages and the stages just goes up to age 6, and so they might be talking about a different measure.
Oh, yes, maybe. Let's see. Make sure I'm hitting all my bullet points. I apologize. Okay, let's see. So, now for parent, ooh, that rolled really quickly. For our parents, we have started using ACEs. We implemented this just a couple months ago, so it's still fairly new to me. I do know that there are ACEs programs that are what's the word that I want? Directed more towards the child and the child's experiences. What we do in our office is we direct it towards mom or dad or whoever's coming in with whoever brings the child in. So, oh, I apologize. Let's see. So, what are ACEs and why is it important? ACEs provides our physicians with reliable, developmental and social emotional information about the parent's child. So even though it's about mom, it can still, in a roundabout way, direct us to what is happening with child. Its main purpose is to pinpoint developmental progress and catch any delays. This allows our physicians to help create a plan that best fits your child and what comes next for them. We have seen a lot of parents kind of shy away from ACEs just in the last couple of months, just because it asks some really heavy questions. Is everybody familiar with ACEs? Yeah, everybody's okay. So the way we implemented it, when we first started, I was having my receptionist hand it out with the child's ASQ. But we were finding that moms were coming back and saying, I'm not answering these questions. Somebody's looking at me. Somebody's going to know. So now actually what we do is my MAs take it into the room with the patient when they go back. And my fabulous MAs talk to my moms about what it is they're going to be doing and what it's for, because the next face that mom sees is somebody that they really trust and rely on as a crucial factor in their child's health and development, and that is our physicians. Some of our moms are 110% sure that our physicians walk on water. They absolutely adore them and I think would do just about anything that the physician asked of them. So we have found that that has helped with implementing ACEs. Let's see. I'm so sorry. Okay. So oftentimes we get asked what kind of health problems come with what we mean by that ACEs helps us correlate to health problems. Most parents are like, I'm filling out a paper about something that happened to me as a child, and you're telling me that I'm not healthy because of it. So we like to explain to our parents that it can cause risky health behaviors, things like drug use, alcohol abuse, things like that. Chronic health conditions, low life potential, and early death. It's been really interesting to see parents really open their eyes to the fact that how you're raised and the situation you're raised in really does affect your entire life. It plays into every piece of who you are, including not just your mental health, but your physical health as well. We get, why does my pediatrician want to know this information? And it's because we love their children. It's because we want their children to be healthy, and we care about them as parents. Knowing what sorts of experiences they've faced in their life will help us know how to guide them through their parenting decisions, and also make parenting a little easier for them. A lot of the times people like to think that if they just smile, parenting looks really fun and really easy. I'm not a parent, but I know that parenting can't be that fun and easy all the time because my mom raised me. So, I feel like it's been really beneficial for parents to understand that their mental health is important for the overall health of their child. The one thing that I feel we have really taught parents, excuse me, in the last couple of months is how important mental health is. Because these parents are coming out of a generation where mental health wasn't really something we talked about quite yet. I feel like some people call it the mental health craze, is more my generation, when we started really paying attention to anxiety, depression, how we were feeling emotionally, not just how we were feeling physically. I've seen a lot of parents make a connection and go, this actually makes sense to me. My behavior is why my child does this. My behavior is why my child refuses to do this. It all kind of ties into the we lead by example. Our children are they're sponges. They soak up everything, even the things that we can't see. And that ties into the mental health aspect. Let's see. I think there's more on this one, but I don't want it. There we go. You're all familiar with how to take the ACEs questionnaire, right? I don't have to explain it. Okay, I didn't know if I would need to or not. So what the process we do is my MA will explain it. If they have questions, the physician kind of reassures mom that this is something that's also protected under HIPAA. We're not asking you to tell us what happened or anything as far as that goes. We are just asking these questions in order to obtain some sort of information. Once they filled it out, it comes to me, and I score them off of their scores. And if they are a 4 or above, that is when we start an intervention plan. My intervention plan is a lot like what I do with my ages and stages. I feel like parents feel like this is really, really scary, which is understandable because it's about you as a parent, and nobody wants to be labeled as a bad parent. I've actually had a couple of parents cry and tell me that they promise they're not a bad parent, they just had bad parents. And so explaining to mom that this shouldn't be scary. It's not scary. We're okay. We're gonna make it okay. It oftentimes sends their mind just racing, and I don't I'm trying to figure out how to lower that reaction, because the last thing we want as healthcare providers, mental health care providers, is for our parents to think that they've done something. Yeah.
So I found this working in the schools as well. I'm also a social worker.
Mm-hmm.
And oftentimes social workers are labeled as like child stealers.
I have parents who refuse to see me because I am a child stealer.
Yeah, because I feel like it's a very common stigma.
Mm-hmm.
And so I work in schools, and so I kind of relabel my job as a feelings teacher, because that's easier for kids and parents to understand than the social worker.
Yep.
And so I don't know, have you thought about kind of maybe starting out, or like seeing what their hesitations about that are? Have you found this as well? Like, what are your experiences with that?
Yeah, so I actually we started with my position as social worker, and I actually just changed it to care coordinator, because I had people who refused to talk to me because they were sure that I had something to do with DCFS and I was going to take their child from them. So I just go by a care coordinator now. It eases people's minds a lot more than I expected it to. I have random people from the community call me, and they're like, "We've seen that you're a care coordinator and wanted to know what that is." And so I feel like that's been helpful to, kind of like you said, you've switched your job title up, was for me to switch that job title up, because now people feel more open to speak to me, because they don't feel like there's an ulterior motive to what it is that I'm there to do. And yeah, when I do go in with people, you can kind of read a person the minute you kind of step into a room. And what I like to do is I tell them who I am, what I do for the office, and then I ask them if they have questions for me before I start asking them questions. That way they can kind of air the room, and I found that it calms people down a little bit more. Yeah. Is there any other questions? I feel like I just keep rambling. Yes?
When the MAs give the questionnaire to the parents, do they have a script that they
Yes.
prepare them to give them the right answers of why they're asking?
Yes. So when we implemented the program, we actually had a 2-day staff training on it. We actually did it individually. So we trained our receptionists on what their job was if parents had questions. We then trained our MAs on what to do if they had questions. And then we also gave everybody a script as to just say this and it will be okay. Instead of trying to be like, well, I'm not sure. And then we have also implemented that our doctors will meet with our MAs and see how parents are reacting to MAs when MAs are giving out those questionnaires, to see if we maybe need to change the script up a little bit, go a different way about it. Does that answer your question? Yes?
Do your pediatricians say anything about it to the parents, or I guess they're given it before they see the pediatrician?
Yes.
Okay. So I just wondered, is there some way that the pediatrician can sort of help in the transition, to see the care coordinator or the social worker, to kind of make that a little more trusting for them?
So what we actually do, when we see their score, or when I see their score, I guess, because the MA brings it out with them once they're finished, the doctor's actually gone in at that time. So when I see the score, the doctor is in with them then. And then when the doctor comes out, he or she immediately comes to me and says, do we need to go back in? And then doctor will go back in and say, hey, that paper you just filled out, let's talk about it for a minute. And then our physician will walk them through the bigger picture, I guess. And then say, we would like you to talk with our care coordinator. She has some follow-up questions for you to see how we can best provide you care. Anything else? So as far as the follow-up end of it, what I do is I should have brought it with me. I thought about it. I have 2 papers that I take with me when I do a follow-up. It is more along the resiliency lines. So I talked to the parent about how those experiences made them feel, how they feel the experiences shaped their lives, what they think impacts them most in their parenting, and then how, I'm trying to think of, the last one's worded really weird. I can't remember the last one, it's worded really oddly. And then we kind of just go through that and discuss as comfortable with the parent, or as comfortable with it as the parent can be, to kind of sift through what it is that the underlying, I don't want to say issue, because that's not a good word, the underlying condition, maybe, without having to say, so tell me about the drugs that were done in your home as a child. Talk to me about those experiences. And then we talk to parents about things like parenting classes and programs that are for their child. Because there's also this big stigma around parenting classes only being for people who are bad parents. I'll use the family place for an example. We have a receptionist, and I asked her before, I'm going to tell the story because she's a doll. We have a receptionist who has a 2-year-old little girl. And she goes, I want to be your first ACEs person. She goes, I want to learn about it. So her and her husband actually filled out the information for me. And then we kind of sat down together and we talked about what they felt they needed to do to break the cycle of parenting. There was some abuse that was prevalent. There was some absent parenting. There was some drug and alcohol abuse. And they want to break that cycle for their child. And I said, well, have you guys ever thought about parenting classes? And our receptionist goes, well, I'm not a bad mom. And I said, of course you're not. She's one of the best moms I know. She is a fabulous mother. I said, of course you're not a bad mom. I said, but you want to learn how to be the best mom you can be for your daughter. And she goes, well, yeah, but I'm not a bad mom. I said, I know you're not a bad mom. And there is that label across it. It's like big red tape that says bad parents only. And she was under the impression that the family place was only for abused and neglected children. She had no idea that the family place was somewhere that she could go to learn parenting techniques and learn, ways to help her child. And it was like I had just opened a door to a whole nother world for her. She was completely blown away. And she called that day. Like, we finished that conversation and she went up to the front phones on her lunch and she called the family place to see what they had available because she had no clue. And a lot of what we hope to achieve with ACEs is to inform parents, to help them. Vonda and I had this conversation a couple weeks ago. Most of the time when we talk to parents about their child's mental health, they feel that we're labeling them as bad parents. Because obviously, if there's something wrong with your child, you did it. You made them that way because they're yours and they're exposed to you on all levels. Some parents don't understand that that's not the case. Some children just need more help than others. And so teaching them is our biggest goal. We really hope to teach and inspire parents to learn with their children. We hope to start a new mothers program. We're still in the works of getting it exactly how we want it, but we would like to start a program that every new mother that comes into our office at her child's her 2-week visit, she gets a goodie bag almost of all the resources that she has available to her for this brand new beautiful child that she just brought into the world. Yeah. See? They know. Especially for parents who it's their first baby. And we're creating one for teen mothers. We actually have quite a few moms who are teens. First-time mothers and repeat mothers. Is that a good word to use? Mothers who have multiple children. Because parenting does change from child to child. We have patients who have 9-year gaps in their kids, and parenting's a lot different now than it was 9 years ago. So we're going to be giving out to those new parents a goodie bag that will have, right now we have burp cloths, we have binkies, and I think we're getting onesies. And then it will have a list of places that they can go for resources. The 0 to 3 website is on, we made a little card for 0 to 3 so they can just kind of read about their child. There is an app called the Vroom app that it's a really interactive app. You actually upload your child's name, and I think you do whether they're a boy or a girl, and then you you will get almost little reminders daily of here's something fun you can do with your child today. So if I had a 3-year-old and wanted them to be more involved in mom's everyday life so that I could get what I needed to do done, if I'm folding laundry, we're going to fold laundry together. We're going to put laundry in piles. Put all the white things in a pile, put all the black things in a pile, put all the pink things in a pile. It's helping your child get involved in what you're doing, as well as also teaching them. You're teaching them sorting, and you're teaching them colors. And you're teaching them that laundry can be kind of fun, which is a bonus. We're hoping to implement that into our office in the next 6-ish months and see kind of if we get more parents who are eager to learn, to not just about the child's physical health, but also their mental health. Vroom, VROOM. It's orange, I believe, in the App Store. Is it orange? I was going to say, it's either orange or green. I always forget. Are there any other questions about that? No? We're good? Let's see. And that's what we do for if they're high risk. Why are these things important? Sorry, my throat's really dry. Oh, and I just knocked off my microphone. There we go. These tools are important in not only mom's life, but also child's life, to help build that resiliency on more levels than I think even we know. Even though ACE is a newer addition in my facility, we have really, really high hopes for it, kind of like I've already discussed. I'm trying to think of how to word this. We want to help parents parent as effectively as they can without them feeling like we're trying to label them. So in that, we're wanting, I use these images because they're images that I use in the office to show parents why this is important. That it's strengthening economic supports to families, changing social norms to support parents and positive parenting. That's our biggest one. Kind of like I was saying before, parenting is super different now. Like the receptionist I was talking about earlier, her husband tried to put rum on the baby's gums. And he was like, well, that's what my mom did. Parenting's very different. Provide quality care and education early in life. If we teach our kids about this now, think about what they will know as parents and what they will be open to learn as parents. Enhancing parenting skills to promote healthy child development, and then intervene to lessen harms and prevent future risk. And then I use the one on the opposite side to show them what adverse childhood experiences are considered. And parents are kind of like kids in this aspect. They like to look at pictures. Pictures make more sense to us. Does anybody have any questions on ACEs or our office, anything like that? Yeah.
I'm curious, you refer up to 3, but what happens after age 3, and then what happens with older kids? Like, how do you intervene there?
So my plan, where I've only been there for a year, most of my kids are 3 or 2.5. My plan is once we've hit age 3, when they start to hit age 2.5 is when we will start looking to outsource from up to 3. I have a couple of kids right now that are about to age out of up to 3, and we'll be heading into early preschool. So I've met with the school district with mom. I've met with the people at up to 3 with mom, and we've kind of discussed where we think is best for the child next to go. So it just kind of depends there on where we go next, but we do try to outsource to more of, that's not what I'm trying to say. We want to walk mom and child through every stage. So say they go to a CERT, say they get into a CERT. But then we don't feel like a CERT is exactly where we want to be. We get together and almost have a staff meeting with everybody who's met with child and worked with the child. And we say, okay, this is where we feel like we're doing really well, but this is where we feel like we're lacking. Can your program give them more of this, or do we need to outsource? And that's the route that I plan to go as I get those kids aging up. Does that help? Okay. Anything else? No, we're good? Okay. Yeah.
So if you do this score on ACEs and you find that the child or the parent doesn't have any, but the child's still having some mental issues, where do you direct them? Like if they're maybe low self-esteem or just depression, like what are some resources you give them?
So for that, I've created some documents that have, a lot of our parents like to read. That's what kind of the consensus I've found. I have reached out to like Vonda and others who have a good outlet for things like that, and I've compiled a list of books and websites that help talk to their child or help talk to mom about their child's either depression or self-esteem or self-harm ideation, and kind of where to go next. I have a list of counselors in the Valley. It has what insurances they take, what ages they take, their specialty, and then how long their wait time is. And we usually, if it's a behavior, anxiety, depression sort of thing that is to the point of affecting their day-to-day life, we will always encourage mom to call the providers on that list and get on some sort of a wait list. Sometimes I have some pull and can get them in somewhere sooner if they're a really severe case, but that's usually what we'll do. Yeah. Yep. Anything else? Yeah.
Do you make any home visits, or have they all been at the office?
As of right now, all of my visits have been in office. We have talked about doing home visits. We're still in the stages of trying to learn how to integrate that without people feeling like their physician is trying to consume their life. Yes.
You know what, Ashley, I remember you mentioning to me one time, though, that you had a patient who was going to be going to the ER for some mental health challenges and asked you to go with them.
Yes. I attend the ER frequently with our suicide ideation patients. If we have a child come in who has reached their point of they've made a plan and they're ready to commit suicide, I will go to the ER with them. And usually the consensus I've gotten is that mom usually will call and follow up with me. If she doesn't, I call her, but I do have one patient who I see weekly. They don't need an appointment. They just come by and we kind of talk with that patient and mom about, how we're feeling that week, how have we reached the goals we've set for ourselves, how are we going to alter those goals to make them more attainable for us. And so I feel like even though we're not doing home visits, I've still kind of integrated myself into their lives somewhat. Anything else? Okay, I want to talk to you guys just for a minute kind of about a couple of cases that I have been able to experience that make me really grateful for the ages and stages and the ACEs program. I have a patient that she came into our clinic with, I gotta remember I wrote it down. She had an unidentified chromosomal disorder. I believe that there are certain parts of her brain that are just completely shut down. I believe that's the case. I didn't go to med school. I'm not 100% sure. Sweetest thing I've ever met. She is a doll. And her parents are fabulous. She was needing multiple support systems in her life that mom just was not sure how to get her so that she could have a normal and healthy functioning life. She is partially blind, completely deaf. She will never walk. She doesn't sit up very well on her own. Doctors have said she'll more than likely be held like a baby for most of her life because she will stay pretty small. So we were needing multiple support systems, and mom was just unsure. I don't think there's no parenting book that prepares you for a child having severe disabilities. And I've had the privilege of working with them since they very first came into the office, and they are now like family to me. They are patients that I either see weekly or speak to weekly. I usually have 2 or 3 emails from mom a week. Dad will call me every now and again. But they've experienced a lot. They've experienced a lot of really high highs and really low lows with this child of theirs. And for them to consider me part of their child's life is so rewarding, because we were able to, even though she was born developmentally delayed, we can now set into motion a plan as much as we physically can to keep her on track to live a healthy, normal life for her condition. I was able to get her very first pair of glasses, and she can now see reasonably. They're the cutest little purple glasses I've ever seen. When Dad calls the office, he says, I need to talk to my main girl, Ashley. He doesn't refer to me as just Ashley. I'm his main girl. So I feel like that's kind of a badge of honor. And it's been really fun for me to be able to do things as small as glasses up to as big as full genetic testing for this child, and to feel like I have made a difference. Another patient came into our clinic and she was having multiple seizures a day that were resulting in just cuts and bruises all over her little face. We had planned to just get her a protective helmet, the ones that have the shield across the front, but they have Medicaid, and Medicaid saw it as more of a cosmetic need than an actual necessity. But when they were denied Medicaid, but between my main physician, Dr. Labram, and myself, we were able to set her up with a foundation that actually got her the helmet, because Mom wasn't able to pay for all the cranial molding that would go into her getting the helmet. And we got her into some therapies, things like that. And since then, she still has not as many seizures, but she's having seizures during the day. But Mom doesn't have to worry about keeping her eyes on her at all times for fear that she's going to seize. And she's had staples in her face. She's had stitches like all over the place. She's got some good scars, but Mom says that now she can take all the bubble wrap off the sharp edges and she's okay. So that's been really rewarding as well, to be able to interact with these people and help them in a way that, yeah.
How have you helped the mom with her own mental well-being?
We talk to Mom a lot about the parenting classes, because in that, not only is it helping her with parenting, it's also helping her remember to take care of her. We like to refer Mom to a family therapist so she can have somewhere to vent and remember that it's okay to not be okay. And then not only do I do well care checks on my kids, I do them on my moms too. If I've had a mom come in and I can tell she's really stressed out, I'll give her a call later that day, or if they're a really close patient, I'll just kind of snag them in the room and be like, hey, are we okay? What are we going to do? And we kind of talk that out there. Yeah. So that is all for me. Again, I'm from Primary Care Pediatrics. Our office email is on there, and if you have any other questions or resources or anything you want to send me, my email's on there too. I know it's really long. I asked them to give me a shorter one. Every time I give it to people, they're like, wait, I need a pen. I need a pen. It's way too long. But are there any other questions? Yeah.
Did the doctors in the practice come to you to hire, or did you go to them and say, hey, I'd like to do this?
I actually am very fortunate, and my uncle is Dr. Barrett Labram. He married my dad's sister, and when he found out I was going into the social work program is when he decided he wanted to implement a social worker into the office, because he can kind of tell me to do anything and I feel obligated to do it, not just because he's my boss, but because he's family. Right now he's really pushing me to get a master's because he would like me to counsel in office. So, yeah. Any other questions?
And you know that, what is that, integrated behavioral health? That's becoming a bigger field now, and hopefully it's going to be more and more common, where somebody might just spend 10 minutes, you know, a social worker might spend 10 or 20 minutes with a patient in a doctor's office to address mental health needs. And they don't see any stigma, they are going to their doctors, and so I think it's something that will continue to grow.
Yeah. We also have a food nutritionist counselor in our office. So that's kind of the route we're going to go with that, is to, because then, like you said, people aren't feeling the stigma, the judgment. It's just a doctor's visit. Anything else? All right. That's all for me. Thank you so much for having me.